Okay, oh, I hope I'm up high enough. Okay, this is Tiffany, HcgHousewife again, and part 2 of my February 2013 TTC Update vlog. We left off at the last one. I keep doing this to my nose. It's not even itchy or anything, but I don't know. It's just something to do. Anyway, back on track. We ended off with me talking about finding an RE. And I may be repeating some of this, but I'm going to go ahead and do it anyway. I met with an RE today at the Frisco Fertility Clinic, and it's part of the Dallas IVF clinic system. And the doctor I met with, her name is Dr. Haveman. She's very nice. She's got, her credentials are just amazing. Her biography is amazing. And like I said, I don't know what part, because I saw 10 minutes when I was filming the vlog, and then only 7 came. So I hope I'm not repeating stuff or leaving stuff out. But anyway, she sat down with me and she told me what we were going to do. Today, she did blood work to check for my thyroid. No, my thyroid was normal last time, so she wanted to check prolactin, glucose, insulin, and hopefully, you know, after that, she's going to put me on metformin or glucophage, which is the same thing. And that's really something that helps with PCOS. She did genetic screening for cystic fibrosis and ovarian reserve testing, which will show how many eggs that I have. She explained to me that PCOS is not the best thing to have, but it's not really because of my age. It's kind of good because since I wasn't ovulating, it's kind of like we were saving those eggs. So I don't know. I'm trying to look at the bright side. Maybe she was too, but your eggs may not be good quality at my age. I'm 40, but because I didn't ovulate for so long, it's like they were being saved. And hopefully, you know, the good ones are the ones that we'll get. So we're going to wait for those test results to come back. And I don't know if I said this in the last video. She had put me on birth control pills, which sounds totally counterproductive, but with a cyst, a 7.6 centimeter cyst, you're not going to get pregnant, and you shouldn't want to because it wouldn't be healthy. So I'm going to be on birth control pills to help simulate or start a cycle. And then on cycle days 1 to 3, I'm going to go back in for an FSH blood test. And she said that a good FSH blood is less than 10. And the last time I had one was 4.3. But we don't know what cycle day I was on, because when I had these tests, I wasn't having cycles. So I really didn't have a cycle day at that time. So she wants to redo that one. And hopefully it's still good. And after all these tests, she's going to do on days 6 through 10 of my cycle, she wants to do an HcG, which will, it's a tubal dye study. They put a dye up in your uterus and tubes to see if there's any blockage. Hopefully there's not. And then, of course, my husband had to have his boys checked, and we haven't got the results back from that yet. So if all of this comes out good, no blockage, his sperm are good mobility, we wrote out a treatment plan, and we know that the pills don't work. The Clomid doesn't work. So she said there was the 4 kinds of treatments. There's pills, the combination of pills and injectables, then just injectables, or IUI and IVF, which IVF would be like the most severe treatment. The pills didn't work, so we're going on to the combo, and this is the plan. If everything comes out good, I will do a combo of letrozole and then 3 days of injectable FSH. Now, if you're following me from the HCG journey, you know I don't do needles. I always did subliminal or pellets. So that kind of scares me. But you know what? I think I'm going to just have to do it because it's what I have to do. It's what I have to do. We always say little Maggie's worth it. That's what we want to name our baby if we have a girl, after my grandmother. So on cycle day 12, she'll do a sonogram, see how many eggs and what size, and the trigger shot to help me ovulate, which I believe that's what the FSH is. And she explained everything to me. It all made perfect sense, but I can't re-explain it. But she did tell me the chance of multiples is less than 10%, and the chance of pregnancy per cycle goes up 30%. She's like, I know that sounds like a low number, and I'm thinking, no, that sounds like a great number because my chance of pregnancy without ovulating is 0. So from 0 to 30% sounds pretty good to me. And she's just, I mean, that's what she does, is she gets people pregnant. So I have confidence in her right now. I know I've only met her one time, but anyway, depending on what my fallopian tubes and uterus look like and my husband's semen analysis, we're hoping that that will be what I need. If I have to go to the next step, IUI, then we'll just go from there. And if I do, I do. If not, that'd be great. If I had to go to, the chances of pregnancy with IVF would be 50%. 40 to 50%, she said. And she said the reason that you'd have to do that is if both tubes are blocked, if you have severe malfaction, infertility, or too few eggs. And we don't think I have too few eggs because I've been saving them up. I've been hoarding them. I'm an egg hoarder. So that's my treatment that we've talked about. And I hope I'm explaining everything okay. So today we had blood work for prolactin, genetic screen for cystic fibrosis, and the glucose insulin blood work done. She gave me a prescription for birth control pills. My next step is to call her on day 1 of full flow of Tom or Aunt Flo. If day 1 is on a weekend, I call on Monday. On days 1 through 3, she's going to do an ultrasound to check the cyst. Hopefully that cyst will resolve itself. If not, we'll have to, see what comes next. I think I said this in the last vlog, but their approach is wait and see. She doesn't think that it's going to twist and turn and cause all kinds of problems, but if it starts to be painful, I'm to call her and we'll just have to do surgery. If it doesn't go away, we'll just have to do surgery. But they like to try to medicate it first, which is great for me because I really thought I was going in there after looking at her biography and all the things it said about her skills with laparoscopic surgery. I thought that she, maybe she was really into surgery. But thankfully I don't have to have that. It's not too painful. I do have cramps, like really bad menstrual cramps, and my back hurts. But I think I've lived with that for so long because I've had cysts before and just back problems in general. And of course PCOS. I think it's like part of it, it's uncomfortable. I sleep on a heating pad. But I can get through it. I don't want to have surgery so I can, I can bear down with it. Sleep on a heating pad, use cod liver, not cod liver, what is it called? Castor oil packs. Take some Advil if I need to. But I'm just happy that I don't have to have surgery right away because that really scared me. Never had surgery before in my life. On days 6 through 10, we'll have the HcG tubal dye study. And we'll meet up and decide where to go from next. I'm looking at the paper that I brought because I didn't even have to go over my questions because she answered them like right away. I didn't even have to ask her. I did ask her, however, what she thought about some of the herbs and things that you see for natural fertility. And I asked her about progesterone cream, parsley leaf, red raspberry tea, and all this stuff. And she said that she believes wholeheartedly that these things can work for some people, but she would prefer that I not use them just because she doesn't know the dosage and they're not regulated, and she doesn't want anything to interfere with the treatment she's going to be giving me. And the way I see it is, I can spend a lot of money at Central Market and the vitamin store for all these herbs that may not work, or I can let my insurance pay for it with her and have someone actually guiding me with it. And I just feel like I have a better chance that way. And, you know, I would love to be natural, but the most preferred method would be no drugs whatsoever. But, you know, I trust her. She knows a lot more about it than me, and going to Central Market and letting the vitamin lady try to sell me some stuff. So anyway, like I said, she was great. She answered all my questions before I even asked them. So I'm going to have to cut this off because it's over 10 minutes again, but I will update when I can. Thanks. Bye-bye.